Salivary gland stones form when the salts within the saliva crystallise, and then they can gradually build, and the crystal gets bigger and bigger until it forms a blockage within one of the salivary gland ducts. Well, we all form salivary gland stones. We form microcalculi, which are really tiny microscopic stones, and usually they flush out of the gland with the saliva. But at times of dehydration or infection, we think that these microcalculi get lodged within the natural kinks and curves and bends of the salivary gland duct, and then they can get lodged there and can then grow as the salts within the saliva crystallise on these microcalculi, and they can get bigger. And again, once they're large enough, they can block the salivary gland duct. The salivary gland duct on average is about 2 millimetres in diameter. So when a stone gets to 2 millimetres or larger, you're likely to start to get symptoms of a salivary gland stone. You can tell if you have a salivary gland stone as you'll start to get symptoms when it's large enough to block one of the ducts. And it tends to be at times when you have something really tasty to eat that your saliva flow increases, and then a stone can block the duct and the saliva backs up behind it. So this gives symptoms of increasing pain and swelling of the gland, so it can really ruin your meals. And the swelling can take about 20 minutes or sometimes up to an hour or a bit more to gradually subside and go down. And there might be a salty taste that you notice in the mouth as the saliva starts to come out. And symptoms can go on for several months to years until at some point it's often that you'll start to get infections within the gland. And at these times, the pain and the swelling will last much longer. And characteristically, the pain and swelling won't settle until antibiotics are given. Salivary gland stones aren't particularly common, and it will be approximately 60 people per million per year who have a symptomatic salivary gland stone. But because of this, many doctors haven't seen patients with salivary gland stones, and so it might take some time before the condition is realised and an appropriate referral is made. There are several different ways of removing salivary gland stones, and really the treatment of choice depends on both the site of the stone within the salivary gland and also the size of the stone. If stones are really tiny, they might well be amenable to basket retrieval of the stone. And at this point you could use an endoscope, which is a thin tube with a camera at one end and a light source at the other, and put that directly into one of the salivary gland ducts. Through this you can see directly into the duct and you can see the stone. And once you can see the stone, you can introduce small wire baskets through the endoscope and into the duct system of the gland to grasp the basket, and then on a camera system you can see that the stone is removed through the endoscope. If stones are a little bit larger, then there are several different ways of breaking them into smaller pieces, and so those smaller pieces can either flush through the ducts spontaneously or make them small enough to be amenable to basket retrieval. The site of the stone within the gland is also really important, because if they're near the exit point into the mouth, you can often feel them, and they're very amenable to maybe just a small incision to remove them. However, if they're much deeper back into the gland, that's more challenging and often for small stones isn't possible. And then the use of these endoscopes is really essential. Much larger stones might be resistant to fragmentation, or it may just be impractical to try to keep breaking a really large stone down into small pieces, because it might just take too much time. And if this is the case, then a surgical approach to remove them is possible, such as making a cut directly where the stone is, if you can feel it, and removing it directly and then putting some dissolving stitches through the duct wall to close it and to aid healing. This technique has reduced the need to remove salivary glands to approximately 3%, and in many centres salivary gland removal is still the treatment of choice. But with salivary gland removal comes several risks, and these risks are a scar but also nerve damage. And the particular nerves at risk if you're removing an entire salivary gland include a nerve that supplies movement to the side of the face, and so you can have paralysis as a consequence of surgery. You could have weakness of the tongue, and you can also have altered taste sensation or sensation generally to the side of the tongue. And so these minimally invasive techniques to remove the salivary gland stone but retain the gland avoid many of the nerve complications of gland removing surgery, and that's why they're so useful.